Hello friends, welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you but help you to move on to the brighter side of the health. As always, I am back again with one new video, but this time I am going to talk about diabetic neuropathy, or else a peripheral neuropathy, a problem which a lot of people suffers from these days because the rate of diabetes is increasing in India. So, what exactly is diabetic neuropathy? What exactly happens or what you experience during it, and what is the management? We are going to discuss all of them in today's video. So make sure to watch this video till the end. Let's begin. Friends, diabetic neuropathy is a condition which happens if you are suffering from diabetes. Exactly what happens is that the nerves that are present in your body, especially the nerves around your foot, your ankle and your hand region, gets damaged due to uncontrollable or high blood sugar levels. Depending on the level of nerve damage, depending on the level of blood sugar that is uncontrollable, and depending on the kind or type of nerve damage, the areas would be affected. Some of the common areas that a person with peripheral diabetic neuropathy experience pain is foot, ankle and hands. It usually starts with mild symptoms but gradually progress as the sugar levels does not come under control and the nerve damage keep on happening over and over again. That's the reason during diabetic neuropathy you will be either experiencing very mild symptoms or the symptoms can go very worse, so worse that it becomes difficult for you to perform your day-to-day chores. Eventually, diabetic neuropathy is a serious debilitating complication of diabetes, and hence it's important that it should be addressed as soon as possible. Mostly, people who are above 40 years of age are more likely to develop diabetic neuropathy, and especially men are more likely to develop diabetic neuropathy compared to women. Even studies have shown that almost 50% of people who suffer from diabetes experience diabetic neuropathy in future as a complication. So, what are the symptoms that would be present in diabetic neuropathy? Well, the symptoms are: number one, numbness is felt around the limbs, as well as there is reduced ability to feel pain and temperature changes. A person can also feel burning sensation in the foot, calf or else even wrist. There are sharp pains and cramps experienced throughout the day and even during the night. There is muscle weakness. There is extreme sensitivity to touch sensation. Even sometimes patient in severe situation can't bear the weight of bed sheet. That much is the pain level that the patient will experience. And in the later stages, serious problems like ulcers, infection in leg is commonly seen, which could eventually lead to bone and joint damage. Sometimes the problem can also go towards the thigh and the proximal region. This time it is called as proximal diabetic neuropathy. In this, similar symptoms like pain, tingling, numbness, burning sensation is felt in the proximal areas of the body like thigh, hips, buttocks, etc. It also affects abdominal and chest area. And a person experiences severe pain, weakness and shrinking of the muscles, difficulty in getting up from bed or chair, and sometimes chest and abdominal wall pain. So, what is the cause behind these symptoms? Well, the cause is simple. When the diabetes is uncontrolled, this eventually damages the nerves of the body. Along with nerves, there is also damage to the small blood vessels or capillaries in the body, due to which the nerves do not receive appropriate nutrition as well as oxygen, which leads to the damage to these nerves. And as the nerves' normal functioning gets disrupted, these kind of symptoms start coming. So, what is the management? More than management, prevention is better here. The more you are able to prevent your blood sugar levels to go bad, the better it is. If you are able to reverse your diabetes on time, you can get rid or prevent yourself completely from developing this painful condition. Along with that, it's also important to take proper care of your foot and hands if you are a diabetic. But let's say if you have eventually developed a diabetic neuropathy, what you can do? Well, there is definitely medical management for this. With the help of your blood sugar control medicines and pain relieving medicines, the pain can be kept or maintained under control, but to a certain extent. Along with that, adjunct therapy like physiotherapy is also very important in management of diabetic neuropathy. Physiotherapy modality like TENS is popularly used to reduce the pain as it desensitizes the nerve which is constantly being irritated. TENS therapy can be taken at home very easily by the patient itself. But there has to be a caution here because there is sensitivity issues. Whenever this TENS therapy is given, it's important to keep in check that there is no damage that is happening to the skin. The current should not be very high because there would be some sensory issues involved with that. Along with that, doing regular exercises, staying regular in your physical activity, you can not only maintain your blood sugar level but can also maintain good muscle health, prevent these muscles from going under spasm and atrophy, and thus helps in managing your peripheral neuropathy. And many a times diabetic patients, if they are obese, then they should also work on their weight management, because if they are overweight, the pressure on the joints and muscles increases, which makes them further susceptible to damage. So that gives you a brief about diabetic neuropathy. I hope you found this video helpful. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ YouTube channel. I'll see you in another video. Thank you.